Morning, Mr. Chair and Commissioners. We hope to impress you with our presentation, especially Commissioner Gross. Just kidding. Sorry. I couldn't help myself. I'm sorry about that. Okay, we are going to provide you with our updated data. And as you can see, we have the Clay County numbers of active cases. And just keep in mind the active cases fluctuate, as Becky reminds us all the time. So it's at this moment in time, they can go up and down, obviously, as the cases come in. So back in August 23rd, we had 168 active cases, and now September 6th, we have 165. So it's nice to see that we don't have a big jump in those cases at this point. Active cases in Minnesota, 11,111, and then now as of September 3rd, 13,829. And the reason why September 3rd for Minnesota, they didn't, there isn't any new data over the weekend. Active cases in Cass County, 347 on August 23rd, and they jumped up to 518 now on September 6th. So they've seen a little bit of an increase over in Cass County. And then in North Dakota, it's 1508 August 23rd, and then September 6th. And the reason why the dates are different is I explained Minnesota didn't have the weekend data, but that's 2,714. So they've jumped up a bit. Our active cases by age group, and you can see that as well, that this also changes. Still the 35 to 39, really close behind it, the 30 to 34-year-olds and the 15 to 19-year-olds, and then the 0 to 4. So we've got 15 of those as well. So we're kind of seeing some changes in that age group, the younger age group for sure. And then we've seen a little bit in the 60 to 64-year-old.
Kathy, on the younger age groups, what are we seeing in terms of hospitalization for those? Do you have any data on that?
Yes, and Becky will cover that in just a minute.
Okay, you're going to cover. Okay,
yep.
Perfect.
Thank you for the question.
Okay.
And then we show the cases per week. So it just, again, gives you the snapshot of back in March of 2020, the start of the graph, and certainly the significant ramp up in October, November, and then another bump up in March and April. And then we have the numbers through August 29th, cases per week. So that's an ability to just, at a glance, see that snapshot. And then I will move it over to Becky to talk about the next information.
Good morning. So I did include this graph this time. I had stopped putting this graph together every week just because we had very minimal hospitalizations, as you can see, like spring and throughout the summer. But a couple weeks ago, we did have a pretty big jump in the number of Clay County cases that required hospitalization. So you can see we had 10 of our residents that were admitted to the hospital for COVID the week of the 15th. And actually, that's the highest it's been since last November. So obviously a little concerning there. The next week, we saw a little bit of a dip with 5 cases admitted to the hospital. But last week, we had, again, an elevated number that was admitted to the hospital. So it was at 9 when I pulled this report. I would expect that number to actually be higher than that once the data has a chance to get caught up. Also of note, the ages of the admitted cases, as you can see, the average age range is 50 years old for Clay County residents. So it's not the elderly or the people over age 65 that we're seeing in the hospital now like we were at the beginning of the pandemic. Minimum age of 4 years old to 90 years old is kind of our age range for admitted cases. And we've had 5 admitted to the ICU since August 1st. And this chart just sums up, this is throughout the whole state of North Dakota, so this is not just Fargo, because that information is hard for us to get, but it does include, these numbers that you see in here are Clay County cases as well. All of our currently hospitalized cases are in North Dakota, so they're reflected in these numbers. So this report I pulled yesterday. There was a total of 102 patients hospitalized just for COVID. 11 of those were in the ICU. In comparison to a couple weeks ago, there was a total of 44 hospitalized for COVID with 6 in the ICU. So those numbers are continuing to increase week by week. And then you can see that they break it down by age groups as well. You can see there's one patient currently hospitalized in pediatrics, so at the 0 to 5, and then also, our middle-aged group, we are seeing increasing number of hospitalizations. And then this graphic was actually put together by the Sanford Healthcare System, and I think it's a good visual for showing what they're seeing in the hospital in terms of people that are vaccinated versus unvaccinated. So red symbolizes the unvaccinated individuals, and then white are the vaccinated individuals. So you can see there's 19, this was done, I believe, August 31st was when this chart was put together. So out of the 19 patients on ventilators, only one was vaccinated. So largely unvaccinated are the people that we're seeing in the hospitals.
Did you have a question?
Yes.
Commissioner Motion.
Just a comment. I know that, one, I really appreciate seeing this because it helps us to understand what's happening out there. But I think it's also important to point out the piece at the very bottom that this is of Sanford's 22 hospitals. And so it's not a snippet of the new Sanford Hospital south of 94. It's all of Sanford's 22.
Yes.
Thank you.
And actually, that does help us to visualize it better since they do have so much more data that really drives that point home even more, that of all of the hospitalizations that we're seeing throughout the Sanford system, almost all of them are among the unvaccinated.
Is that all North Dakota, or is that all Sanford?
All Sanford. So I
That's
think they
including
have
South Dakota?
20, three states, I think? Yeah.
Okay, and then I'll talk a little bit about the vaccines that are being provided. So this last week of August 29th, we had just 71 doses that were administered. Things slowed down a little bit, mostly because we had done quite a few in our universities. And so looking at last week, we had a first dose clinic at M State, so that was our first time at M State on Wednesday, and then continued to offer to our K-12 schools and the Family Service Center. So the 71 doses is all of those sites combined for last week. And then for this week, we'll be doing some doses at the Moorhead High School. The majority of those Wednesday from 9 to 11 are second doses, but an opportunity for first doses as well. Another clinic at the Family Service Center on Wednesday from 1 to 4:30. And then MSUM, majority second doses, but some first doses also on Thursday from 10 to 1. That's what we have planned for this week. And then just looking at the next slide there. The statewide data, looking at our statewide data, 2 weeks ago when we were here, the number of people with at least one dose of vaccine across the state of Minnesota was at 39.6%, and we're at 70.8% this week. And then people with the completed vaccine series 2 weeks ago was 65.2%, and we're at 66.5%. So continuing to crawl up a little bit in our vaccine doses. And then again, you can see that down at the bottom, the number of people that have had vaccine by age group, and the majority of ours are still in that 65 plus, but seeing a rise in the 50 to 64 population, which hopefully is going along with the increase in those that are positive and hospitalized as well. And then we continue to climb in the 12 to 15, so getting a better response to those 12 to 15-year-olds as well. That's that. And then back to Becky.
All right, so this is just the current breakthrough cases data that we have from the state of Minnesota. And just a reminder that a breakthrough case is somebody that's at least 14 days past their final dose of a vaccine that winds up becoming infected with COVID. So the number of breakthrough cases has increased a little bit in the previous weeks, so we're at 0.415%. of people that have been fully vaccinated that wind up getting COVID. Breakthrough hospitalizations are still very low at 0.027%, and breakthrough deaths have not moved, so 0.002%. So again, very, very negligible numbers. And then this is just our level of community transmission. We have not changed since last time we met. We're still in that red or that high level of community transmission. As you can see, the majority of the state of Minnesota is now at that high level as well. And then I included this time at the bottom just the metrics that the CDC uses to rate each county as low, moderate, significant, or high.
Kathy?
Yes, Mr. Chair and Commissioners, we also want to just mention, there's lots of questions about booster doses.
Yes.
And right now, I'm sorry, thank you. Talking about booster doses, and that, when we talk about booster doses, it would be the third dose, if you had a 2-dose vaccine, Pfizer and Moderna, or another additional dose for the J&J. However, FDA and CDC are not authorizing that yet. We often hear, and it's coming from the federal government, that excuse me, there's a specific date, but there is not. They're still working on the booster doses. So for those people that are calling about that it has not been authorized yet. They're still working on that. The one that is authorized is the dose for those that are severely immunocompromised. And those would be people with that are undergoing chemotherapy, for instance, or stem cell, HIV. There's some very specific criteria for those people that would receive that additional dose. It isn't, for example, someone notified me they have diabetes and asthma. That additional dose is not for those. It's for the severely immunocompromised. At this point in time, Minnesota Department of Health really wants us to work on and focus on the unvaccinated. This is a vaccine-preventable disease, so they really want us to focus on those unvaccinated before we get into a dose for the severely immunocompromised. So we're recommending that if people are in, have that immunocompromised state and are considering whether they should get it or not, we recommend that you talk with your medical provider so they can give you the best information about whether you qualify for that and where you can receive that. But public health, we still have so many that are unvaccinated. We need to really focus on the unvaccinated is our mission at this point.
Commissioner Ebinger.
Just a question, one of the surprise questions you may not be prepared for, but reading the paper this morning and listening to the news yesterday, they spoke of the Mu variant that's out now. There are concerns that it may be even more contagious than the Delta, and we know what the Delta did to us. Do you have any additional information on that? They said it's been found in 49 states. And also, just for the public's benefit, could you explain how these variants occur in relation to immunizations?
Becky, I think that's directed at you.
So I have not, I have heard the same news stories that you have. I haven't been able to keep up with the actual scientific facts behind that yet. I think that's, still more to be determined in terms of that new variant. But to answer your question about variants, so every time a virus replicates within someone's body, it essentially will make a mistake, and so the genetic part of the virus will swap with other parts, and it becomes different. And so the more that the virus circulates throughout our population, the more chance, I guess you could put it, that genetic swapping will happen. A lot of times when variants come about, it's not a benefit to the virus, but sometimes it is. And so, what we're seeing now with SARS-CoV-2, the virus that causes COVID, is that it's kind of found a way to jump into the population where it hadn't been an issue before. So it's becoming more infectious, and it's also infecting younger people, which we hadn't seen before. That answers your question.
I give you a setup here, would immunization interrupt the ability for these variants to occur?
Yes. Yes. The more people that become infected, the more probability of variants happening. Absolutely.
One more reason to get a shot.
So this infection likes to find a host that it can live within and then expand.
Right, right.
And if it can't live through going to Commissioner Ebringer's, the vaccine,
Right.
the likelihood of it being able to expand or mutate
Right.
is reduced, right?
Correct.
Okay.
Yeah.
That-
A virus is not alive until they need us as a host. It's not like a bacteria that can live on surfaces. The virus infects a person and takes over the cell machinery, and so it's completely dependent on us. The more people that get vaccinated, the less chance it has to mutate.
Excellent. Excellent information. Anything else today, Kathy, Jamie,
I
Becky?
think that's it, unless there's other
Well,
questions.
Thank you for your report. I think we'll still, I know you're all busy, but I think we'll still ask that you come back on a weekly basis until we see this calm down again. So,
Absolutely.
thank you.
Thank you very much.